Good evening. This is Scott Kuiper reporting for It Pays to Shop Southlake and the Great Southlake Chamber. We just wrapped up another town hall meeting on health care. I'm joined by Congresswoman Ginny Brown-Waite. We want to thank you for the presentations both this afternoon and this evening. As you all know, the Southlake Chamber and all chambers are comprised of small businesses. I own a few small businesses and I have employees. And so I was wondering what kind of impact the new legislation on this new health care bill would apply to me. For example, one of my employees does not take her insurance from me. Rather, she uses her husband's insurance. And so what kind of an impact for small businesses can I expect?
That's an excellent question, Scott. And under the bill that is currently before Congress, she would be considered as a non-covered employee, and you would be assessed an 8% fine, 8% fee, because she's not covered by your insurance. Now, your insurance that you have today may not be deemed an acceptable insurance plan under the bill before Congress. We don't know yet what's going to be an acceptable plan. So, if you have 100% coverage, let's say, for the delivery of a baby, and the government says, no, you not only have to have 100% coverage, but you also have to give 6 days off or however long off paid vacation. This gets into a very expensive proposition for small businesses. And that's one of the reasons why the majority of small businesses in my district do not support this bill.
Well, that's disappointing to hear. What can small businesses like myself do to help maybe voice some concern about the bill or the plan bill?
Well, that's one of the reasons why I held town hall meetings, both with constituents and with healthcare providers, was to hear their views. I encourage people. Now, I'm not supportive of the bill as it's currently drafted. We do need healthcare reform, but the bill as currently drafted is not a good bill for the consumer, not a good bill for Medicare recipients, and so I want healthcare reform out there. I'm not in the majority, though. A majority of the members of Congress want that bill. So I would encourage you to contact other people in your field. Your field happens to be investments. Other people in your field in other areas, and ask them to be in touch with their member of Congress to express their concern for small businesses.
Okay, that's great. And is there any more information that we can go to and find out more information, maybe a website?
Well, you actually can see the bill, but the bill is not in the current form because the leadership, Speaker Pelosi, has not combined all of the amendments that have gone through the process. So it's not a complete bill yet. So that you would go on to thomas.gov to get the bill. My hope is that they will start from scratch and come up with a real bill that will make health care more available and much more affordable, while still giving the doctor-patient relationship the primary relationship that it belongs in, and not have a government bureaucrat between them.
Well, thank you so much. We appreciate you coming out today. I know it was a long day. You met with the Orlando Sentinel this morning, and then the 700 attendees that came out to the town hall meeting in Mineola, and then quite a few people that came out as physicians tonight for tonight's meeting. So we appreciate everything that you're doing, and thank you for the good information.
Oh, you're very welcome. Thank you. And just a word that I love coming over to the Southlake Chamber meetings, and whenever I'm in town on a Friday and available, I try to make it over here. You've got a very active Chamber of Commerce. Great job.
Well, we love you too. Please come back soon.
Thank you.